Hi, coding cadets. Welcome to Billing and Coding Mastery. My name is Dr. Charlotte, and I'm your host. I'm in beautiful, sunny Abilene, Texas, outside my hospital, just soaking in the sun. And the reason why Abilene is a great place is because people are kind, warm, caring, considerate, and Abilene is one of those nice small towns where you can get everywhere you need to be in about 15 minutes. So I'm just going to wait a few extra minutes and see if anybody is around to enjoy our billing and coding update and mastery session. Today I'm just going to go back to the basics. Every little word they put in the manual is important. So sit down and relax, and let's talk about some basics of medical documentation. The first thing that has to be clear and on your medical record is a location. You never think about that, but the location of where you are putting your service or doing your service matters. For example, some doctors decide that, hey, I'm not busy enough at my primary clinic, and then I want to go to my secondary clinic, but the insurance company wants to know that. The insurance company, if you put a different place of service than what you're credentialed for, then they will not pay you for that work. So, your medical record needs to document the place of service. If you're a doctor that only works in one location, that doesn't matter. But if you do work in a satellite clinic and you have to make sure that you say satellite clinic Midland, Texas, or satellite clinic Odessa, Texas. So that is something that's very important to make sure that you are noting on the place of service. Another thing, we're going to just move a little bit closer to my internet connection. Usually I just stream from my phone, but I need to fix that. So another thing that's very important on the medical record is the appropriateness of the service. So if somebody is complaining, I'm an ophthalmologist, if somebody is complaining of a eye problem and it's just a foreign body and you remove it, then you have to you shouldn't be doing an MRI or CT scan. So part of the record, the medical record, is documenting what you're doing to make sure that the appropriate testing is done and the appropriate testing is justified by your history. So one thing that we did discuss several weeks ago is that all of us need to give our opinion to the new Medicare scheme of making the documentation easier. So basically not making any distinction between an outpatient code that ends with the 9.2 and then goes all the way to the 9.5. So, you have to document the appropriateness of your work no matter what. So doctors, as a physician, I know I take care of a bunch of complex patients, so saying that I have to document less doesn't really hold true, because if you want to justify doing a test, you have to have it in your record. So, now with electronic medical records, they do not have problems with legibility. You can read everything, and everything is just written very clearly because it's typed. So, people arrange their medical records to include the chief complaint, to include the HPI, to include the past medical history, to include the past surgical history, view systems, etc. But before your assessment, your clinical plan, your medical care plan, all that stuff is the medical record is basically a journal of the whole encounter. So the medical record is where it was done, what happened, and why there's other tests that need to be done. So today I was focusing on back to basics. And back to basics is making sure that you take an appropriate history. So an appropriate history it's not appropriate history. So a history has 3 levels according to the billing and coding manual. And so one history, can be brief, but then you only get brief or small pay. One can be extended, so a brief or an extended HPI. So there's basically brief or extended when you take a history of a present illness. So if you take a history of present illness and you only ask 3 elements, then you are basically going to get the lowest amount of funding. If you asked 4 elements, tap the invite. So an extended history has at least 4 elements. So today I want to step back and talk about how to take an appropriate history of present illness. We are back to basics. Thank you, Dr. Diane, for joining me about the billing and coding mastery. We're just starting at the beginning. These are things that I wish I knew that were the language of billing and coding when I started. And today we're just going to cover something short. The history and present illness. What's the difference between extended and brief? So when you take a history of present illness, it is talking about why someone is there. So as an ophthalmologist, I had a patient today. They complained of eye pain. Well, which eye? If it's pain, is it severe pain? How long has the pain been going on? Does the pain move to another area? Is there medicine that makes it better? That is defined as modifying factors. And the duration. How long has the pain been going on? So just asking those questions allows it to be an extended history. So a brief history, it would just be left eye pain, happens occasionally. So that's brief. So if that eye pain is actually vision threatening and I did not document that or add those other questions on how long it's been going on or the severity of the pain, then that's the more extended history. Then I would not be able to bill the more extensive code for my hard work of trying to find out why somebody has eye pain and blurry vision all at the same time. And when you're in medical school and residency, they don't tell you why, they just tell you to take a history. They're not telling you why you're taking a history. Well, the background is important. A brief history only includes 3 bullet points. An extended history has to have 4 or more. So today it was just a brief focus on what is in the medical record and why it's so important, and how do we start the medical record to make sure that we get the appropriate compensation for our work. The good news is my name is Dr. Charlotte. I'm a board certified pediatric ophthalmologist, one of the few pediatric ophthalmologists in West Texas. I'm a coding strategist because since I've learned to master billing and coding, I consistently bill within the 50th percentile of ophthalmologists nationwide. So my purpose and calling is to help young residents, physicians in the first 5 years of practice to make sure that they know why they're doing it and to make sure that they get the compensation they deserve so they can continue their passion, taking care of patients so they can be paid appropriately. So hopefully that'll, prevent some burnout because nobody wants to work hard and not be compensated. My last announcement is that the billing and coding mastery is going to start occurring twice a week, Tuesday evenings and Wednesday morning. So we always have to make a little bit of time for the business side of medicine. So I hope you will share with your friends the new time of billing and coding mastery. And you have a blessed day. Thank you for tuning in. And if you have any questions, don't hesitate to put it on my Facebook page, and I'll try to address it in the next session and #replay. Have a blessed day. Thank you.